This presentation discusses telehealth and its role in modern healthcare delivery, particularly within psychiatric mental health services. Telehealth has become an essential component of healthcare system because it expands access to care, improves patient engagement, and allows providers to deliver services efficiently across geographic locations. In mental health care especially, telehealth has become increasingly important because many psychiatric services rely on communication and observation rather than physical procedures. Throughout this presentation, I will review the concepts of telehealth, its benefits for both patients and providers, the competencies healthcare professionals need in order to practice telehealth effectively, and the different types of telehealth services available, and the 4 general service delivery systems used in telehealth practice. Telehealth refers to the delivery of healthcare services using electronic and digital communication technologies. Instead of requiring patients to travel to healthcare facilities, telehealth allows providers to deliver care remotely through tools such as video conferencing, secure messaging platforms, and remote monitoring devices. This approach has become particularly valuable in improving access to healthcare service for individuals who live in rural areas or communities with limited healthcare providers. In psychiatric care, telehealth is especially useful because mental health assessments often rely on conversation, observation, and therapeutic interaction rather than physical examinations. As technology continues to evolve, telehealth has become an increasingly common and effective way to provide healthcare services. Telehealth plays an important role in addressing many barriers that patients face when trying to access healthcare. These barriers may include geographic distance, lack of transportation, financial limitations, or limited availability of providers in certain regions. Telehealth helps reduce these obstacles by allowing patients to attend appointments from their homes or other convenient locations. This can significantly increase access to mental health services and improve continuity of care. Patients who might otherwise delay or avoid treatment may feel more comfortable engaging in care through telehealth. In psychiatric care, consistent follow-up appointments are essential, and telehealth can help ensure patients continue receiving the support and treatment they need. Telehealth offers numerous benefits for both patients and healthcare providers. For patients, telehealth increases convenience because they can attend appointments without needing to travel long distances or take significant time away from work or family responsibilities. It can also reduce waiting times for appointments and increase access to specialized providers. For healthcare providers, telehealth can improve efficiency by allowing them to reach more patients and manage care more effectively. Additionally, telehealth can support better care coordination between healthcare professionals and improve overall healthcare system efficiency while maintaining high-quality care. In order to provide effective telehealth services, healthcare providers must develop specific competencies. First, providers must have strong clinical skills in assessing patients remotely while recognizing the limitations of virtual interactions. They must also be comfortable using telehealth technology and troubleshooting technical issues when they arise. Communication skills are particularly important in telehealth because providers must rely more heavily on verbal communication and subtle behavioral observations. Additionally, providers must understand legal and ethical guidelines related to telehealth practice, including privacy protections and proper documentation. These competencies help ensure that telehealth services remain safe, effective, and patient-centered. Telehealth also involves several ethical and legal considerations that healthcare providers must address. Protecting patient privacy and confidentiality is essential when using digital communication platforms. Providers must ensure that the technology they use complies with HIPAA regulations and protects sensitive patient information. Informed consent is another important component of telehealth practice. Patients must understand the benefits, risks, and limitations of receiving care through telehealth. Providers must also be aware of state licensure requirements, especially when treating patients who may be located in different states. Proper documentation of telehealth encounters is also necessary to maintain legal and professional standards. Telehealth services can generally be categorized into three main types. The first type is synchronous telehealth, which involves real-time communication between patients and providers through video conferencing or telephone visits. The second type is asynchronous telehealth, often referred to as store and forward technology. This method allows patient information such as medical images or diagnostic data to be transmitted electronically for later review by healthcare providers. The third type is remote patient monitoring, which involves collecting health data through digital devices and sending it to providers for ongoing monitoring. Each of these telehealth approaches plays an important role in expanding healthcare delivery. Synchronous telehealth refers to real-time interactions between healthcare providers and patients. These interactions typically occur through live video conferencing or telephone appointments. Asynchronous telehealth, also known as store and forward telehealth, involves the transmission of patient information to healthcare providers for later review. This approach can improve efficiency and allow healthcare providers to manage patient care more effectively, especially when immediate communication is not necessary. Remote patient monitoring involves the use of digital health devices that collect patient health data and transmit it to healthcare providers. These devices may include wearable fitness trackers, blood pressure monitors, glucose monitoring systems, and other medical technologies. Remote monitoring allows healthcare providers to track patient health trends over time and detect changes that may require an intervention. This approach is especially beneficial for managing chronic conditions because it allows providers to monitor patients continuously and respond quickly if health concerns arise. There are four primary telehealth service delivery systems used in healthcare. The first is video teleconferencing, which allows patients to interact in real time. The second is store and forward transmission. The third is remote. And the fourth is mobile health or mHealth, which refers to the use of smartphones, mobile applications, and wearable technologies. In conclusion, telehealth has become an essential component of modern healthcare delivery. It improves access to care, enhances patient convenience, and supports more efficient healthcare systems. For psychiatric mental health providers, telehealth has significantly expanded the ability to reach patients who may otherwise face barriers to treatment. However, healthcare providers must develop strong competencies in technology use, communication skills, and ethical practice to ensure telehealth services remain safe and effective. As healthcare technology continues to evolve, telehealth will likely remain a critical tool for improving access to mental health service and supporting patient-centered care. And then here are the references. Thank you very much.